The respected chairperson, Dr. CRS sir, moderator Dr. Vikas Menon, and today's speaker Dr. Siva Ilango, Dr. Vijayraghavan, and dear members of Tamil Nadu IPS, scientific committee members, postgraduates, very good evening to all of you. On behalf of Tamil Nadu IPS, the Enrich webinar is organized in every month on second Tuesday. There is an overwhelming response for this Enrich webinar. There are many psychiatrists who have sent a request they want to speak in this Enrich webinar. So please continue to post your name and the area of interest. So depending upon the availability of the slot, the opportunity will be to talk about this. Today we have two excellent speakers, Dr. Siva Ilango, and Dr. Siva Ilango is the chairman of the Chennai Psychiatric Club, and also Dr. Vijayraghavan from SCAR. Vijayraghavan play a vital role in running this project of employment exchange for mentally ill persons. So we can learn more about them. Thank you all. And now I request moderator Dr. Vikas Menon to take over the session.
Thank you, sir, and thank you to all the people who have joined this webinar for sparing their time. This is a very important topic and something that's not very often discussed. That we are going to now. I will not say introduce because CRS sir requires no introduction to any of us. Sir is a very senior consultant psychiatrist and a former professor at Madurai Medical College, and widely recognized as being the principal psychiatrist of modern psychiatric healthcare in Tamil Nadu. Of course, now we all know, along with his son, he has started the Integrated Psychiatric Healthcare Center, Rahana Hospitals in Madurai. Lot of prestigious positions and awards sir has held, and it is our privilege that we have him here to talk, to introduce the topic, something in which he has done a lot of community-based work on. So I think sir is the right person to introduce this topic. Over to you, sir, CRS sir, for setting the topic in motion.
Thank you, Vikas Menon. Am I audible?
Yes, sir.
Yes, sir. Yes, sir, you are.
Right. So thank you, Vikas, for your excellent introduction. And this topic is the need of the hour. The need of the hour, because now we have created an awareness, and also we have creating the treatment facility. And from our part, we are sensitizing the importance of the rehabilitation program, rehabilitation facilities. But one thing is, this cycle will not be complete without employment. So that is the most important thing. In any community psychiatry, there are 4 R's. We are rescuing the patient from their community. By giving the treatment, we are restoring the mental health. Then after restoring the mental health, we are by giving the rehabilitation, and we are making them an able person. But after the rehabilitation, the employment is the most vital thing. After the employment, then we will send them back to the community reintegration. That is the 4 R is an essential in community psychiatry. That is rescue, restore, rehabilitation, and reintegration to the community. The employment is the most critical cornerstone of the social inclusion, and the people living with the mental health problems. And the most unfortunate thing is, the people living with the mental health problem and illness are facing the highest unemployment rate of any disabled group. Although people want to work, and although the people have got the ability to work, for many, the employment remains an elusive goal, contributing to the material deprivation, poverty, exclusion, isolation, and loss of esteem. In any physical illness, I think for the August audience, I need not highlight all these things. For the physical illness, the individual only suffers. But in mental illness, not only the individual, but also the family suffers. Not only the family suffers, the entire society suffers. Because at the prime of the career, an able person becomes a disabled, and an asset becomes a liability, and the liability becomes a permanent one. So the getting them the employment, it is not only giving the boost to the morale of the patient, but also give a new life for the entire family. And in this regard, today we have got two important the speaker, Dr. Siva Ilango, and who is going to talk about the employment exchange cell, and another the speaker, Dr. Vijayraghavan, who is going to speak about the empowering individuals through the employment. Now, in my experience, in fact, the 10 to 15 years back, I have started a special employment exchange here under the banner of the M. Chellamuthu Trust and Research Foundation. In our experience, what I have learned is getting employment for the mentally ill, it is very easy. But one thing is you should keep it into the mind is the employment should have a meaningful for the patient, and also it should have a meaningful for the employer. And the third important thing is it should have a meaningful for the family. These three things are more important thing, because using our influence and using our position and post, we will get any employment for the mentally ill. But it is again I am emphasizing one important point is it should have a meaning for the patient and meaning for the employer and as well as meaning for the family. The third important stakeholder in this the process is the treating psychiatrist and also the psychiatric social workers, because the type of the medicine, type of the illness, and also the type of the activity which they are going to give, and it should be discussed with the psychiatrist. So that is the four important corner. The one thing is psychiatrist and the patient and as well as the employer and as well as the family and networking by the social work. This networking is very vital and very important. So regarding this, now I request, in fact, at the end of the meeting, I will share my experiences. What are how I started the whole thing, and what are the obstacles I faced, and what are the lessons I have learned, and how we can take it to the further. So I am extremely, again, I am doubly congratulate the Indian Tamil Nadu Psychiatric Society chapter for taking up this the vital assignment for the mentally disabled. So now I request Dr. Siva Ilango to talk about the employment exchange cell, and I will share my experience at the end of the meeting.
Thank you, sir. I'll just, okay. Well, at the outset, I'd like to thank Dr. Ramasubramaniam, sir, for accepting to chair this session. It's a great privilege to have a stalwart for this important topic who has been, doing this for several years in our state. And also, rightly he said, this is not a new or a novel idea, but this has been there for a lot of time. But how it has been operationalized and how it has been, carried on further, and that is what we have done in collaboration with the SCARF. So I will share. My topic will be only very, very limited to how this idea evolved and how this project kicked off from our side. And Dr. Vijayraghavan, the other speaker, will take over further about the process, actually what has gone through in the last 1 year. We actually did this presentation in the ANSEPS. I'm sorry that if some of you have attended, and probably this is a repetition of what we have spoke earlier. And before I proceed, I thank two important people who have contributed immensely for taking up this project, Dr. P.P. Kannan from Chennai Psychiatric Society and Dr. Mangala ma'am, who has been, in the advisory role as well as supervisory role to carry out this project. So just to proceed, I don't want to go into the details of what rehabilitation is. At least I just want to, go into the definition of what rehabilitation is all about. a set of intervention. This is something given by World Health Organization. It says clearly interventions designed to optimize functioning. So this is where we are talking about optimize functioning. So we deal with a lot of mentally ill individuals, as sir rightly pointed out, in the adolescence and early adulthood. So they start having a mental illness, and that illness not just produces symptoms, it actually causes a disability that makes that individual not able to do a function that majority of the people for that age does. So what we are supposed to do, as we all know that, yes, we in clinic, we sit, we treat symptoms, and we try to get the person back on track. But then, do we achieve that level? Do we get the person back to that functioning? For an individual, for a college going student, he has to pursue the education back. And for the person who has been working, and he has to go to the employment. So this is what we are trying to talk about, optimizing the functioning. That is where the idea comes from. So I sit in a clinic, I sit in a hospital, I see patients coming in. So we give medications and we give education, we do psychological counseling, all support we do. So the patient improves over a period of time. So what is next? So that is where we get stuck. So I know that I need to rehabilitate the individual. I learned a lot about rehabilitation. But then if I want to vocationally rehabilitate somebody, or if I want to send somebody for an employment, what should I do? Where should I go? Where should I call? So I'm stuck there. I don't know what else to do. So that is where this idea, like how this can be operationalized. And I don't have to repeat this, as sir said. Compared to physical illness, mental illness, it not just affects the individual, but the whole family as well as the entire society. So for somebody who actually has got a job, it actually helps them to maintain the remission. Imagine person has improved the symptoms, but then couldn't find a job. What will happen? His self-esteem goes down, his self-confidence goes down, and then some kind of negative cognition develops that leads to as his confidence goes down, it probably is things like, what's the point in taking medication? Nothing changes. So it actually leads to kind of some relapse. So if somebody gets a job, it maintains revision and prevents relapse. That is at the individual level. And if you look at the family level, yes, definitely it reduces the expressed emotion. A person who remitted from the symptoms, doing nothing, what do you hear from the family members? So you need to, that having a job, it actually reduces the focus from the family and reduces their expressed emotions. And the very important point, I from my perspective, I think like, a lot of times we think when the stigma reduces, people will get job. People will find, employment. People will do a lot of other things. But then actually, why don't we think the other way around? When people get employment, when people get housing facilities, when people get, easily, their marriage facilities going on. So this will minimize stigma rather than the stigma minimize, and then all these things will happen. So for me, if somebody, has some kind of a facility or opportunity to get into a job, and if he proves that I am good at doing this job, I'm qualified, I'm able to do this, whatever the job means, then that the people surrounding them will know that, oh, right. So this is not something that I was already thinking about, that having a mental illness, I always thought like, people are not able to do, but actually he's doing better job than a person who doesn't have a mental illness. So this in turn will minimize stigma in the society. So that is what I think, having a job is going to minimize stigma at a larger level. So now this question comes, how do we get the placement for a person who has recovered from a mental illness, who has remitted from their symptoms? So that is the very, very tough question for us to answer. So if I have a facility like, okay, I can take a phone, or I can have a card, I can give the number, please go and see this place where you can, discuss about opportunities. For me, I remember in the last, at least in the 1 year, I work in a medical college hospital as a faculty. So I have seen patients' relatives, particularly the parents, requesting, So symptoms remit ஆயிடுச்சு. But then when they want to find a job, we tell them, okay, இவனுக்கு ஏதாவது ஒரு வேலை ரெடி பண்ணி கொடுங்க. He will get better. That will actually improve his confidence. He'll prevent relapse. They put back the question to us. நீங்களே கொஞ்சம் பாருங்களேன். So that made me to think, actually, we found in our medical college hospital, we have 4 people employed, having anxiety disorder and as well as schizophrenic illness in different levels. Like, one is the lift operator and the other person is, ward boy, and the other one is an office assistant. So if I was thinking, like, if I am in a position where I can find jobs for some people, so there will be so many psychiatrists practicing in this, in the city. So they will be in a position not just at one point the patients who is needing an employment, rather than they can also pick out the employers who probably would be in a better position to understand these problems and offer placements. So that is where this interface comes in. So we know at one point I see patients who need employment. On the other side, I also see patients' relatives who are in a position, who is in a managerial position, who is in an executive position, who actually can, in a human resources section, who actually can find a job or who can employ a person because they know their relative is suffering from. Once they recover, and they will be employable. So they are in an understandable position. So why don't we make use of those resources for the benefit of other persons? Recently, I had a person in my clinic. That person was, he was traveling to 10 kilometers. He was boarding a bus, going to a 10 kilometers distance, doing a job, or a cycle stand, he was doing some ticketing work. And then he comes back. Unfortunately, around the COVID time, he lost the job because that place has to be shut down. And since then, the last 2 years, he has been suffering. Though he recovered, he couldn't find a job again. So now he is getting relapse and remission, and this cycle goes on. So earlier he had a job, now he is not having a job. So where is the problem, and how could we employ? When we tell their parents, they say that they couldn't find another similar job in the nearby place. So there is a problem in the area as well. So we have opportunity, even if it is a distance. How do we know that there is a job opportunity? So that is where the interface comes, whether we have opportunities at local level or in the regional level. So I know that job opportunities in my hospital, but how would I know similar job opportunities will be available elsewhere in the nearby hospital or in the nearby factory or in the nearby government setting? So this is where this employment exchange cell or place that will help. We know very well that there is an employment exchange registration for people who have graduated, and they go and register. That's Chennai. I remember after pursuing MBBS, I came all the way to Chennai to do a registration, employment exchange registration once. I did it in some 20 years ago, and I received some, I think that I think post couple of times from the employment exchange, which I didn't bother about later on. So this is something that is available for normal people, normal individuals. But then what is there for people with mental illness? We know that the challenges they face, purely because of the stigma. So why don't we develop a model for ourselves so that we can make use of this program or the cell for the benefit of our own patients? If we don't do it, then who else is going to do it? So that is where this model actually started kicking up. But then we have this idea, and fortunately, in Chennai Psychiatric Society, we, in the last few years, we've been receiving some CSR funds, and at the courtesy of Dr. P.P. Kannan, who has attracted some CSR funds for the society. And we were actually thinking about what are we going to do with the funds. So we don't want to spend the funds in CME, organizing conferences and so on. So we want to actually do some service for the people. So what we did in our EC meeting was we will plan to invite proposals from the members of the society, mainly focusing on generating care pathways or improving service delivery or addressing service gaps, so that it will be useful for the patients. So we had a project presentation, and then we had a discussion within our executive committees to approve which project will be more beneficial. So that is how the Chennai Psychiatric Society came into the picture. And fortunately, we had one presentation from Vijayraghavan on behalf of SCARF about this model, bridging gap between employers and employees, particularly the mentally ill patients. So we had a MOU signed on 29th of September 2022, and we released funding as one of 6 lakhs. That was 30th October 2020. So that funding actually carried on for 1 year duration. And so since November 2022, a core team was formed with the members of Chennai Psychiatric Society and SCARF to supervise the program, monitor the activities, and provide necessary support for the carrying out the program. So since the last 1 year, we had a few meetings online, and the actual work gone on within the SCARF setting. So they identified a place, and they employed a staff, a social worker, as well as they trained a lot of people. They met, they did focus group discussion. I think Vijayraghavan will take it to you further in details about the actual process of what happened over the last 1 year. But to summarize, this actually gave us immense satisfaction. We actually utilized the funds very, very responsibly to the benefit of the patient. So from our side, from Chennai Psychiatric Society, as a member and president, as an office bearer, we thought like, okay, we did a great job. And we had a good collaborator from the SCARF who helped us to execute this model. And this has been, after 1 year, they kind of somehow obtained funding to sustain this model, and this has been going on now within Chennai. So now almost, if not all the practitioners in Chennai are very much aware of how to make the referral and how to connect with this employment exchange cell. But we are trying to sensitize people more and more. And as Dr. Pannisalvan sir pointed out, we thought like, yes, this is actually helping to, if not all of the people, definitely a few people are being benefited with this. So why don't we expand this project to a larger population, to different, at least if not across the state all of a sudden, but at least 1 or 2 places in the state with the help of the local psychiatric society. So this is where we are right now. And I should thank the scientific committee of TNIPS for giving us the opportunity to showcase what has been going on. This employment exchange program held, conducted on behalf of Chennai Psychiatric Society and the SCARF. So I thank all of you for listening, and I'm ready to take questions in the end, but I will hand over now to Vijayraghavan to carry on with this process of what is going on with the employment exchange program. Thank you.
Thank you, Dr. Siva Ilango. Now we will proceed to the next speaker. Yes, sir. So I'll just introduce Dr. Vijayraghavan very briefly. He's a consultant psychiatrist at Schizophrenia Research Foundation, Chennai, and he heads the research wing of the Department of Youth Mental Health also at SCARF, and he's an adjunct faculty at ICMR National Institute of Epidemiology, Chennai. And he's interested in community-based interventions to improve mental health of young people. And as we have heard from Dr. Siva Ilango, Dr. Vijayraghavan has been working in the space of employment and social recovery of individuals with schizophrenia, young individuals with schizophrenia. And we are all very eager to listen to his work and insights on this very important topic. So over to you, Dr. Vijayraghavan.
I must thank the Tamil Nadu IPS for providing an opportunity to present what we have been doing for the past 1 year. At the outset, I must definitely thank Chennai Psychiatric Society, especially Siva Ilango and P.P. Kannan for providing all the support, all the ideas. And it is not actually a project where it has been funded by CPS and executed by SCARF. It's actually a joint project where everybody collaborated and everybody took active part. And the most important or the strength of the program is actually it is seen as a community program where everybody is getting involved. And I understand at the end of this program is that the strength is from being a community program where everybody is taking part in it. And also I must thank Dr. Mangla because she is the backbone of the project, because she was working on this project day in and day out and monitoring, coordinating and supporting, and also liaising with a lot of employers, employees, and conducting all the data collection and other aspects of it. Thanks, everyone. Having said all these things, my previous speakers has already spoken a lot about the importance of employment, and especially Professor Ramsam sir has already talked about his insights, and we are very eager to hear what he's going to talk about, his learnings, personal learnings at the end of this talk also. So I'll try to keep the talk very minimal and try to cover as many aspects as possible. So one important aspect about this project, as Siva Ilango previously told, it was a great discussion in the CPS group to sit together and think about an employment exchange cell or a program for persons with mental disorders. And everybody unanimously thought that the role of a psychiatrist should not end only with prescribing medicines and providing psychological support and improving the symptoms alone, but the ultimate goal of the mental health professionals should be to improve the well-being of the people, and especially to make them put back in the community and able to make them what they are capable of doing at their best. So with that milieu or with that philosophy in mind, we thought that employment should be the most important one for all the persons with mental disorders, and we wanted to make sure that that is being provided. During the process, we already saw the paper by Ramasubramanian sir, and we thought that it's important that we must have more focus on the details and also the logistics and also the ways in which it must be executed, so that it could be scalable, sustainable, and also it is feasible, and it is also acceptable by people. So we took into all these into consideration, and we developed the whole project. And we took time at the initial 3 to 6 months to actually have a lot of insights from different stakeholders, from persons with mental disorders, their caregivers, and employers and previous employees, mental health professionals, and also from the social scientists, so that we put together a great number of ideas together before actually coming up with the model itself, because the model is the ultimate, and based on the model we actually pilot tested it and saw some results. So I'm not going to the benefits of employment. We all know what it is really important. The most important thing is that when we discussed in the CPS that this activity should not be an institution. It is not a scarf activity. It is a collaborative activity by all the psychiatrists in Chennai, so that everybody is for referring persons with mental disorders, and also sharing details about potential employers, and also the ways in which they will be able to connect and also help us in this process. And when we looked around, there was no program actually was available to make sure that people are able to refer and get some support for employment. One another important discussion point what we had was, rather than concentrating more on the vocational training, which has a lot of, I mean, definitely there is a need for it, but it takes a lot of energy, time, and also resources to actually put person with mental disorders who are not recovered in the process. But here we thought that consciously made a decision that we will work only with persons with mental disorders who are improved and who are in the stage of getting employed but not able to get a proper employment. So we wanted to work only with those people. So at the outset, we had this kind of inclusion exclusion criteria, so that we will be able to manage the inflow of persons with mental disorders, and also we will be able to dedicate our energy to actually finding employment for these people rather than working on the vocational rehabilitation side. And we also wanted to make sure that the program is designed in such a way that this is actually transplantable to various other parts of the Tamil Nadu or India as such, because we wanted to keep it as generic as possible, and also with minimal resources we will be able to run the program. With all these things, we have wanted to develop a specialized program. I should not say it's a specialized program. It is an important program for persons with mental disorders, where they will be able to connect with the program and able to get employed. I will spend some time on this slide, even though I do not have all the details, but I will be able to explain things. So for the process of the development of the model itself, we have 3 important stages. One, first, the scoping review. Here, we wanted to know about what are all the existing programs, employment exchange programs in India, in all over the world, to see what kind of programs are happening. And also we wanted to understand what are the factors that have an impact on employment and dropping out from employment and not getting employment. So most of the things which we are already aware of, like individual factors such as the gender of the person, and also the age of the person, the severity of the illness, the stage in which the disorders are, so and what kind of a disorder, they have an active role to play in making a person getting employed or not getting employed, or also staying or maintaining the employment. And other factors like family also played an important role. Other than that, there are come from the employer side. There's lack of awareness about what is mental health disorders, and also expectations, and also other factors such as distance. Those can also played an important role. And then with all these insights, we created a qualitative interview guide and invited stakeholders from different dimensions, like persons with mental disorders, their caregivers, employers, mental health professionals. And we wanted to understand what it is important, what it is means by employment, what it is important, and what are the things that need from different dimensions. Interestingly, one of the most important factor that emerged repeatedly in the qualitative interview was that distance has been an important factor for getting employed or staying in employed state, rather than very many factors. And one another, I mean, even though it has not emerged from this study, one another study we did at STAR for a DNB thesis, we understood that peer support within the company in which they are working, the employment space, if at all the co-workers are really supportive to the person with mental disorders, even if at all they are not able to be very productive, I think that also made them stay back in the job rather than any other factor. Even person with severe mental disorders or with symptoms are able to sustain the job if at all the peer supporters or all the peers who are working in the community in the company are accommodated to them. And also these from these kind of things, we understood that it is not only important to work with persons with mental disorders and finding a job, it is also the responsibility of mental health professionals to go to the community, sensitize the community of employers to make them aware that people are capable of, people with mental disorders are capable of fulfilling the job roles. And also, if at all they are giving some sort of support from the company and from the co-workers, they would be able to flourish and do much more things. So one of the important things that we should be considering, I mean, maybe I'll talk at the end of it, that it is important to work with the employers also. And once with these two data points, we had a group of experts invited. We had workshops on developing the model itself. And initially, we had a model and we tested it, and we understood certain discrepancies or difficulties with the model. We went back, and it was a very iterative process, and it was a very amazing journey that we were able to go back and forth, and especially to have discussions with Siva Ilango, Jay Kumar Menon, and Daniel, to actually think about what it is happening, and then be able to modify the model in such a way that it is acceptable. And at the end of the day, this is kind of a model that we have developed, and we understood that it is in I will just run the model for another 3 to 4 minutes, because this is the most important one. Here what we understood that practitioners are very busy, and we developed a kind of a simple assessment tool for the practitioners, so that they will be able to use the tool and assess the person with mental disorders whether they are improved and capable of going for a job immediately. And whilst the disseminating information about this program itself, we explicitly told all the practitioners that please send persons with mental disorders who are improved and able to be getting employed, rather than persons who are little ill. So for that, they had a self-assessment. At the same time, we also developed a small Proforma to make sure that people are able to refer things. And once they are into the system, we had our own system of assessments, so that we want to make sure that they are employable at the right moment. Already they are employable, and once they are employable at this here, we went further. But if at all people need further support, we stop there, because they are not immediately employable. We refer them back to the psychiatrist, or we ask them to go and meet a occupational therapist, so that they will be able to get the needed support. And then once they are improved, they can come back into the employable space. And once they are in the employment, we provided them with different kind of opportunities. One, direct employment, and also training. Here, the training is basically from government sectors or from other NGOs who are actually providing training. Not only training, but also they provide employment opportunities immediately after the training. So invariably, who people are in the training are also kind of getting employed much more sooner than others, and there are people who are directly employed. Certain in the direct employment, certain important things has happened, because whenever we talk with person with mental disorders, we would tell them that we can find an employment for you, but we would tell the employer that you have mental health issues, because we want to be frank with the employer and say that we are coming from this space. Some of the patients agreed for it, but some of the patients are told that you just give me the names of the employer or information about the job opportunities rather than you directly taking me, because I don't want to be go through the program itself, because I don't want to be seen as a person having mental health disorders. So for those kind of people, we provided guidance and we tried to provide the job placement for them. And after the job placement, we followed them up, and then we people who are sustaining in the job, we weaned off the kind of a follow up with them. But we had people with dropout, and we went back to them and asked them about the reasons, and we put them back in the common pool. And once in the training section, if they're getting trained, and once they are completing their training, either they're getting placed by themselves or they come back to us and we'll try to match the opportunities. Here, I must say that the success of the model is all depends upon the person who are working with us, especially Mr. Aravind, who is a psychologist and who has dedicated a lot of time and energy in this project, was able to do an amazing job. And the most important thing is that he is able to go back liaise with so many people. I'll come to that a bit in another minute. So I will just rush through the tools that we used. This is a brief screening questionnaire that we developed, and it was kind of a 0 to 10 Likert scaling. And this was given to the practitioners so that they will be able to use this and score, and then refer the person with mental disorders to us for further help. And also we used a Proforma, which is self-administered semi-structured Proforma, which asks some questions about employability, what kind of employment and things like that. And also vocational potential scale, which we use from NIMHANS, and which covers a lot of other aspects of it. And this is brief about. I think another important reason for the success of the program is the continuous work of a few people in the project on various aspects. For example, we have to disseminate consistently. We have to be on the lookout for job fairs and other aspects. And also we have to be proactively go to the employers and talk about that we are having such a program. We will be able to refer persons for mental disorders for job opportunities and things like that. So this made a huge change. It not only from the employer side, from the employee side, because whenever, we had referrals from very many practitioners from Chennai, and we are also accountable to them that we have to make some kind of a effort or a meaningful effort with the persons with mental disorders to get them employed. And we did that, I guess. But for that, we need to work a lot on other aspects, such as providing information and spreading the word. And we put posters, and not only, and wherever it is possible, we circulated this with the practitioners in Chennai. And we also, wherever possible, for example, in answers, we try to present these things so that it gets more visibility and people will be able to refer persons with mental disorders. We did a lot of employment, job opportunities, skill training programs. And again, I would say this skill training is by government. In a sense, we also learned a lot that there are so many things are out there in the community, but we do not know what is actually available. But if at all we will be able to synthesize all the information and have one point of contact through which can be coordinated, I think we will be able to do a great service for the person with mental disorders who are coming to our clinics. And also it is really heartening to say that there are very many employers out there who are willing to employ persons with mental disorders. There could be various reasons for this, but at the outset, they are actually open-minded to actually employ them. And one another thing that we understood during the program was that it is not that we should be doing all the work. It is important to find appropriate partners. There could be other NGOs or other organizations who are actually working on the employment sector. We just have to have a discussion with them, collaborate with them, and that itself would open a lot of doors, because practically speaking, an individual itself looking out, or a psychiatrist within a city or within a group knowing the employers would be very difficult, because everybody is busy, they might forget that we have to be referring employers and employees, and it is very difficult. So it is important that we have to work with them and making sure that we get some resources from them. At the same time, it is also important that we work with other institutions, various. For example, we work with an institution called Magic Bus Foundation. It's an amazing institution where they are very productive, and I think the institution is pan India. I met one of their vice presidents in Delhi when I was there, and they are doing able to do. It is not only for persons with mental disorders, which is another important thing was that before we collaborated with them, they usually worked only with persons with physical disorders, physical disabilities. But once we had a collaboration with them, had discussions with them, they are also open-minded and say that, okay, let me also explore whether we will be able to help persons with mental disorders who are also kind of a disability. So people are open-minded and able to help with us. And this is what we have achieved till date. And we had around in the past 12 months or so, we had around 250 referrals from persons, from practitioners from Chennai. And we are able to assess only 185 when I put the slide, which is a little bit older slide. So 185, and we are able to employ around 30% of the people, which itself I see as a good number. But at the same time, I would not be very jubilant about it. But I think with time and energy, this number I understand that could have gone up if at all we would have had more connections, more contacts of employers. We would have been able to do much more a good job. And also we have people who are completed training is around 12%, and we are in the process of employing another 50%, 50 people on the employment itself. We do have dropouts, but as I said, the focus of the project is to get employed and also provide a minimal amount of support for sustaining it rather than a continued job. But we make up in that way by making sure that at the start of the program itself, people are finding the jobs which is very appropriate for them, which itself kind of helps them sustain the job, but various other factors could be playing to drop off from this job. So having said all these things, this is more kind of a discussion me and Dr. Mangla had and others at some point in time. I also had a lot of discussion with Dr. P.P. Kannan on these aspects. Where we want to go from here is the most important question. And one thing from as a researcher, I would say that this is a very small time span with a small sample size. And we are able to showcase that we are about 30% or 40% of people who are getting into this program is getting employed. 40% for a program is, I think, would be I would say mild to moderate success kind of a program. So I would be happy, but I think at the same time, if we will be able to do much more things, if it is going to be a much more larger program where very many stakeholders are involved in this, and we will be able to do a bigger network. And to achieve that, it is important that we should not be restricting ourselves only with mental health professionals and persons with mental disorders and employees. We should be spreading out and trying to bring in various people from other sectors who are experts in that area and collaborating with them to make sure that it is important. The second most important thing is that whether we'll be able to run this program in different parts of Tamil Nadu, because there are various kind of a group and zones within Tamil Nadu where psychiatrists are very actively participating and working in their locality. I think that would sell, because even if at all if somebody is in Chennai and trying to have a central office, they will not be able to know that what is happening in Coimbatore or Madurai or Tirunelveli. So it is important that we have to collaborate with people there, they using their own resources, creating such kind of activities, which gives them responsibility, ownership, and also pride when it comes to actually they are able to be successful. And two things I would end with. It's one, we need more data at some point in time, sustained input, and for this, and also both from funding, both from human manpower and other things. And the second aspect is it's an amazing service. And if at all we are able to be successful in providing the service for a larger people of persons with mental disorders, I think we are truly doing a amazing service for persons with mental disorders. I would stop right now, and I think we will be able to have more discussions on this. And I think I'm looking forward to hear from Professor Ramasubramaniam on his ideas, his learnings, and how we'll be able to incorporate those kind of aspects within the learnings that we have at this point in time. Thanks, everyone.
Thank you, Dr. Vijay, for a very insightful presentation and for giving us, insights into how the EEC at SCARF has gone on. And it's really wonderful to know the work that is being done in this space. And the particularly pleasing was the fact that, this it doesn't end with placing them in an employment program, but the follow-up that is also given to them and then contacting them for the reasons of dropout and all those were very, very interesting and very, very, pleasing to note. So congratulations to your team for that. So we do not have any questions in the chat box, but I think we are all very eager to hear from CRS sir about his reflections on this topic. So over to you, sir.
At the outset, I congratulate the two speakers, Siva Ilango and Dr. Vijayraghavan, for their excellent work. Don't think that you have taken a small sample size. It is not a small sample size. The amount of work, the amount of dedication, the amount of devotion, also the amount of determination you have put for these people, it is noteworthy. Because I know the practical difficulty in all these things. And it is an ideal example wherein the community actively participates in the rehabilitation program and as well as in the reintegration program. And today, your presentation gave a good insight for all the participants and also for the senior people like me, because the process of the treatment will not complete. Will not complete only with the medicine, not only but also with the rehabilitation, but it also with the employment that gives a meaningful the meaningful life or also dignity. It gives a dignity to the family member. In fact, in our trust, some 15 years back, we have initiated a small thing called Udyog. And it was initiated and it was mooted by the important stakeholders in the society who are really interested in the mental health movement, especially retired senior the engineers, senior lawyers, and senior bureaucrats, and who wanted to do a real worthy, wanted to contribute something for in the life of the mentally disabled. So they started an Udyog under the banner of M.H. Chalamutha Trust and Research Foundation. And the first, what we thought that we want to sensitize all the important stakeholders in and around Madurai about the importance of the employment and also the importance of giving employment for the patients and also the responsibility of the community in all these things. Initially, we received a lot of negative feedback and a lot of resentment and also negative attitude from the public. But what we did was, we conducted all these sensitized programs in our rehabilitation units, which is situated some 10 kilometers from Madurai. In our rehabilitation unit, the unique feature is all the employers are the recovered patients who are kept insane, who are kept in dark room, who are not wanted by the community. Once upon a time, now after the treatment and after the rehabilitation, they are doing a wonderful job. So our people, after giving the sensitization and after seeing the wonderful work done by these people, their negative attitude changed to a positive attitude, and they came forward to give a job or to give a helping hand for these people. Now the job, now our first after sensitizing the important stakeholders, and we send the letters or our our aim, our letters to all the industries which is situated in and around the Madurai. And also, we conducted simultaneously the sensitization program for the employers, because our my strong belief is the employers should be convinced about the program one, and they should not give the employee job just because for the sake of giving a job or for the sake of helping a disabled population. So here we don't want to compromise the quality. We don't want to compromise with with anything. So we negotiated with the employer, and also we sensitized about giving the employment. And the second,
Sierra sir, for your very valuable insights and directions that you have also provided for future work in this area, because there is also there are no questions in the chat box, but that is also, I think, a very important point to discuss, and I leave it open to the speakers here who want to speculate on that. How to scale this program across the length and breadth of Tamil Nadu? What are the next steps in this regard? Any thoughts from the speakers?
Thank you, sir. I think it's very valuable insights from what you have shared with us, because we actually are in the process of expanding this project across the state, at least if not all the places. We have had discussion with the TNIPS President, Dr. Panirselvan sir, as well. TKTT Association, sir is very much involved, at least, from TKTT and Kongunadu, and we also in the process of speaking to Trichy Association. So if not all the places, at least in 2 or 3 places where like similar model, like what we have in Chennai, at least the employers who are in a better position to employ people, we can sensitize the employers and we can take it further, at least expand to a bit more areas. And then from there on, we can take it to the next tier 2 cities as well.
And another suggestion is, you can form a self-help group among the family members of the disabled. And you can motivate them to start a microeconomic activities.
Okay.
Then their kith and kin, they can become the employee in that organization. That model we are practicing.
Okay, sir.
Because in the long run, we cannot take up the entire responsibility. And we should initiate and we should motivate the family members and as well as the community to take up the responsibility. Then we should become a facilitator.
Yes.
This also you can think of. And again, you should have a complete data profile. And you can send the intimation letters to so many people, organizations who are working for the disabled the people. You can send them letters. You can call for the details of the disabled sector, except the visual, and you can involve all the other disabilities. And you can have a database, and it depends upon the employer's need, you can send them. But again, I'm stressing, don't set the responsibility of following up the case.
Yes. I think, as you pointed out, sir, I think going back to Dr. Vijayraghavan sir's question, yes, the model has to be expanded further. That is the plan, ideally. Like Vijay was saying, first within the state, and then if not, if it is become, we can identify the benefits of this program. It can be also be replicated throughout the country as well, so that more and more people will be benefited. But then the learnings are quite huge, and as we progress along, there will be a lot of learnings. Like sir is saying, the employment exchange has to just focus only on the employment. We are not going into the treatment of art or to manage other aspects. So when it comes to the employment, it is the onus on the referrer, whoever the practitioner, like Vijay was sharing. The first screening assessment with the referral. So the referrer has to screen that individual whether he is potential for employment from his point of view. And that is the first check. When it goes to the employment exchange, there comes the second check where they go through Proforma, and then they will find out whether, yes, this is a trainable person, or he can go for direct employment, or he needs to be sent back to the referrer for further improvement of the symptoms. So there will be a 2 checks in place, and that is what SAR is also emphasizing, that we should not be held up in the process of improving the symptoms or treatment perspectives. This is purely for employment, and once the person settles in, I think we kind of wean off and then let them take over, let them become more independent, and the family continue the process rather than we kind of go on for months and years.
Yeah, thank you very much to CRS sir, both the speakers, for very insightful, and I think we have had a very rich and very productive conversation on this very important topic. I'm sure I enjoyed it a lot. I'm sure all of you enjoyed it as well. And now I will hand over to Paneerselvam sir for concluding remarks. Is that right, sir?
Thank you, Dr. Vikas. Thank you, Dr. CRS sir, for chairing this very important session. I think this is definitely, the webinar will definitely create awareness among the young psychiatrists. On behalf of Tamil Nadu IPS, I think we want to start this the Chennai and SCARF model to entire Tamil Nadu local branches. And I hope that we can get this help from suggestions from SCARF, Chennai Psychiatric Club, and Chellam Trust also. And I thank once again Dr. Siva Ilango, Dr. Vijayraghavan, and all the members for active participation. And we'll meet you in the